According to the CDC's most recent estimate, 13,000 people die each year from urinary tract infections acquired in hospitals. Countless others suffer through it. And so much money is spent on treating this type of hospital-acquired infection that Medicaid and Medicare now refuse to pay for it. We're joined by Gary Damkohler, President and CEO of Bioderm, a company that has focused much of its effort on preventing infections related to urinary incontinence. Welcome, Gary.
Thank you very much for inviting us, Jackie.
And Steve Babb, Bioderm's Vice President of Technology, also joins our conversation.
Thank you, Jackie.
First, Gary, why is managing urinary incontinence such a major issue for hospitals today?
Well, Jackie, there are 1.7 million people with hospital-acquired infections each year. And of that, 40% are urinary tract infections. And the problems caused by those infections cost hospitals approximately $2 billion a year. Plus, we have the diaper problem that exists within the hospitals, where people are sitting around basically in urine much of the time, causing severe problems and illness, particularly pressure ulcers, which to fix these pressure ulcers cost about $11 billion a year.
And now Medicaid and Medicare are not paying any more for hospital-acquired infections. That's huge.
Right. Well, what Medicare did is says, wait a minute, these infections from UTIs and these pressure ulcers from diapers, we should have never had those. So what they've developed is something called never events. These are just two of them. There's many others that they've done. And they said, hospital, if you cause this infection, if you cause this pressure ulcer, we are not going to pay you for it. You have to eat the expense.
Very interesting. So Steve, tell us who Bioderm is and what types of solutions Bioderm offers.
Well, Jackie, Bioderm works in incontinence care, wound care, infection control, and we innovate products that replace the outdated products out there that are causing infections, complications, and even the deaths you talked about. So we have a flagship product, it's called the Liberty, and it's for men's incontinence. And it replaces adult briefs, pads, diapers, condom catheters, indwelling catheters, and this is all for men at a lower cost.
And the infection rate?
There haven't been any infections reported that are attributable to the device.
Well, let's see how the products are working in this 21st Century Health Field Report.
Bioderm introduces an innovative external urinary management for men called Liberty.
Some of the benefits that we've seen from using Liberty, I would say definitely less skin breakdown, less pressure sores. It's really given us freedom. I like the name Liberty because that's what I think of when I think of using it.
Liberty was developed to provide more freedom for men seeking a better method of urinary management and aims to make urinary output monitoring and management healthier and more comfortable.
I would strongly recommend that anyone considering an external catheter system try the Liberty. It's very easy to use and the customer service is excellent. I cannot say enough about the product. I really encourage any moms, wives, caregivers to give it a try. I think you'll be happy with the results.
Liberty has been used successfully in more than 1 million applications among community-dwelling men, with not one reported adverse event attributed to Liberty. Bioderm has provided a solution that gives the opportunity for men to make bladder control a normal part of their lives. In the end, Liberty promotes freedom. Freedom to enjoy life without limitations. For 21st Century Health, I'm Steve Michaels reporting.
You know, Gary, this really hits home for a lot of people. What problems do patients and their caregivers face when trying to manage incontinence, and how does this affect their quality of life?
Well, Jackie, you've got about 1 in 10 people in the United States that have some form of incontinence. There's a lot of social problems associated with this. People who are afraid to go out because of the odors that they may create, and so you may have a husband or a wife that says, I'm not going to dinner with you because I'm concerned about my incontinence. Right. Then you've got the severe problems, of course, as we've discussed about the infections that are taking place. And you've got caregiver problems. It is not easy to turn, for example, a heavy, maybe overweight male or female in the bed to put on diapers. But now, as we know, we're talking a male product here. The female one we hope will be coming soon.
So Steve, explain Liberty and what makes it different from anything else that's out there on the market today.
Well, Jackie, today Liberty is the only completely external urinary collection device for men that keeps them clean and dry 24/7. And it's based on a hydrocolloid barrier that reduces complications such as infections and wounds. Wounds that might include serious skin sores and ulcers.
How important a change does this product make in the medical industry itself?
Nothing's been done with this in over 50 or 60 years. This is a dramatic change and can dramatically decrease the infection rates and the hundreds and hundreds of millions of dollars hospitals are spending on both diaper-related problems and catheter-related problems.
So Gary, what plans and hopes do you have for Bioderm and its products in the future?
Our objective, of course, is become the preeminent incontinence management system in the United States and in the world. Never be I don't mind being a little optimistic.
Don't aim low, aim high.
We'll take the U.S. down, we'll conquer the rest of the world tomorrow.
As you mentioned, you're working on a product for women as well, correct?
It's a little bit more difficult technologically to produce one for women, but we are convinced we will be able to do it.
Well, it sounds like countless lives could be spared and countless dollars saved thanks to your focus on preventing these horrible infections. Thanks to both of you, Gary and Steve, for sharing the news.
Thank you very much for having us here today. It was very much appreciated and a pleasure to meet you.
Thank you, Jackie. I feel the same.